As COVID-19 vaccines are being made more available to the general public, many questions still remain about the vaccines, who they'll be distributed to, and when. Will you get vaccinated against COVID-19 soon? What should you expect if you do get vaccinated? And will these vaccinations help us get back to our normal lives? To help us answer all of these questions and more, I'm joined by Dr. Andrew Martin, our infectious disease specialist. Thank you so much for joining us and guiding us through another phase of this COVID-19 pandemic.
Thank you, Rebecca. Thanks for letting me be here.
So Dr. Martin, it's been about a year since we did a frequently asked questions series with you. That was when the coronavirus outbreak first hit the United States. Here we are now with at least 2 vaccines available to the public. One of the big concerns that many people had was that the vaccine was produced quicker than normal. Can you explain why doctors have so much confidence in this science that was developed and how it's worked out so far?
The technology or the platform with which it was produced is known to work already. We just have not used it in vaccinology or in the vaccine world. We've used it for chemotherapeutic agents in the past. Once the pandemic came aboard, the pharmaceutical companies realized that they had the technology to create a vaccine. They just never done it before because they didn't really have the need to. In this case, obviously, there was a great need. The reason they've been able to mass produce it is because the technology does not need to use any live virus or any live organism to mass produce the vaccine. Here, what we're doing is we're just basically fabricating a piece of mRNA. We're putting into a lipid-soluble solution and injecting it into the body. And what we do is we trick our own cells in the cytoplasm to produce an antigen that is exactly like the antigen on the virus and create a controlled antibody response. So we know that this works, and the studies done by Pfizer and Moderna also prove that.
We know that both of these vaccines are 94 to 95% effective, but do we know how long they can protect us from catching the virus?
That's a good question. We don't even really know how long antibody response from natural immunity lasts because we know that it's different in every person. We don't have enough data to really say how long it's going to last, how long that immunity is going to last. What I will say, however, is that if we vaccinate enough people, we will create enough herd immunity, meaning that there will be enough people vaccinated that are unlikely to transmit the virus, or that if they are able to transmit the virus, it will be to other vaccinated people. That if we create that herd immunity, then the virus itself will kind of die off or fade off. So even if it is not a long-term immunity, if we are able to vaccinate enough people quickly enough, we will successfully beat this virus.
That herd immunity would also kill off, so to say, the several mutated strands of the coronavirus that we're now starting to see about?
So far that we know on the mutations, we believe that the vaccines work against the current mutations. The only thing that the current mutations are really doing are they make the virus more transmissible.
And now that these vaccines are being made available, who should be signing up to get them?
The most important population to get vaccinated would be patients 65 and older, especially those who have multiple comorbidities or live in nursing homes or assisted living facilities, who live in communal associations. Patients 65 or younger than 65 who are immunosuppressed definitely need to get vaccinated as well and should fall into that higher tier group. After that, I would say everybody else.
And what about those people who have already had the virus? Should they get the vaccine even if they still have antibodies in their system?
If a patient has been sick and 90 days after they've been sick, they still have antibodies, there probably is no reason to get vaccinated urgently because you already have antibodies. That's what we're looking for with a vaccine anyway. And just check your antibodies, with some frequency, maybe every 2 to 3 months. And once they wane, then you get vaccinated. Is it wrong to get vaccinated even if you have antibodies? No, absolutely not. You can definitely do that, and there's nothing wrong with that. However, there have been many reports that the likelihood of having more marked adverse effects from the vaccine when you have antibodies or close to an illness is pretty prevalent. So you may get sicker or may have, more side effects from the vaccine. You're not going to get sick from it in the sense you're not going to get COVID-19. You're just going to have pretty significant side effects.
So going off of that, of course, this is a personal decision. So as people learn more about the vaccine and decide to get it, what should they expect? Any symptoms or side effects that almost all people receive once they get the vaccine, or does it differ from patient to patient?
No, I mean, there are certain side effects from the vaccine that are very common. They're common in both the Moderna and the Pfizer vaccine alike. The most common ones are headache, fatigue, joint discomfort, fever, and injection site pain and redness. With the exception of maybe the injection site pain and redness, all the other side effects on most patients don't last more than 24 to 48 hours.
And are there any specific guidelines they should follow to lessen the chances of symptoms?
Taking Tylenol or ibuprofen around the time of the vaccine and for 24 hours after is perfectly safe and will help with the side effects. So you can do that to try and minimize the potential for side effects.
For those that do get symptoms after receiving the vaccine, what are the key factors they should be looking out for that suggest they need to call a doctor?
So most of them who are going to have severe side effects, and again, very few will. I believe, in December, there were 13 cases of severe allergic reactions out of 300,000 doses. So that is slightly higher maybe than the average vaccine, but certainly a lot lower than the risk of getting COVID-19, and certainly a lot lower than a lot of the other allergic reactions that we have, like to peanut allergies and to penicillin and to other antibiotics. But usually you'll get those severe allergic reactions within the first 30 minutes, 15 to 30 minutes. Very few will have severe reactions afterwards, and most centers will have you wait 15 to 30 minutes after the injection to make sure you don't have one of the severe side effects. Now, if you do have a severe side effect afterwards, meaning feeling lightheaded, diaphoretic or sweaty, fainting, or having hives or severe swelling at the injection site, then you should seek medical attention right away.
I know that earlier you mentioned herd immunity. It's been a long year for everyone, and the world has been hopeful for these vaccines to be created and then be distributed to help put an end to the pandemic. But now that we're here, how long do you think it's actually going to take for us to get back to what we consider our normal life?
Well, I don't know the answer to that question, but I think I will go off of the words of Dr. Anthony Fauci, which I heard recently. And his thought was, if we are able to continue to vaccinate at the rate of 1 million a day, which is what we want, then we should be able to look at achieving herd immunity, hopefully by the fall, at which point we can start probably getting back to normal.
And do you think this pandemic has been an eye-opener for those that do not have a primary care provider or don't go to the doctor for their yearly checkups?
I hope so. I mean, we couldn't have, or the government and even, us as practitioners, we've made it easy for everybody to access us. I mean, now we have the option of telemedicine, which is not perfect, but certainly does help bridge that gap between patient and provider. I certainly hope that this is in part a lesson learned, and getting the vaccine will help us achieve that herd immunity that we need to be able to stop the spread.
Going off of that, any advice that you can give to people who are a little bit hesitant to get this vaccine because of all the unknowns and everything that's been going on this past year? What would you tell them?
They have to pay attention to where they're getting their information. You know, social media has been very difficult to battle. Everybody has an opinion. The problem is you have to have a well-founded opinion to be able to help people. It's hard. It's a hard and it's an uphill battle with all of our patients because of that. There's a lot of myths out there about the vaccine. I think that going to the reputable sources to look for information on the vaccine is extremely important. Both of the approved vaccines so far have a humongous amount of data that was well done. It was a blinded study, and it has proven efficacy. And the difference between them is negligible. They're probably equally as effective. Everybody should get vaccinated. It doesn't matter which one you get, as long as you get it.
Awesome. Well, thank you so much, Dr. Martin. Hopefully this can give patients a better insight on this vaccine. And on our website, toplinemd.com, we do have more information on COVID-19 and the vaccines that are available right now. Plus, if you don't have a primary care provider or a pediatrician for your children, all of our affiliated doctors' information can be found on our page, where you can choose the right one for you.